Good morning. Good morning, everyone. My name is Sarah Lavonne, and welcome back to my YouTube channel. It has been a hot second. That has been intentional. I will get into that today, but I am thrilled to connect with you right before Thanksgiving and talk all things pregnancy, labor, birth, what I've been up to, whatever nursing questions you have. I am here for you, and I'm thrilled to be here. Before I get into it, and as I'm waiting for people to log on, if you have live questions, I'm going to prioritize those because those of you that are here live, that matters to me. It's a big deal. Most people watch this back later. And so flex and flow on that, but make sure that you're getting your questions ready. In the meantime, I want to tell you about Ana Luisa. You have all probably seen previous Coffee and Questions where I have mentioned this brand. I am currently wearing, hi Gracie, I am currently wearing 3 of their stunning dainty. I always use the word dainty because I'm all about the dainty small. These are also theirs that I have. I pretty much wear mostly Ana Luisa. One of these is theirs. Jewelry. And so if you are looking for a gift for a loved one, it is now the holiday season. Black Friday is coming. How many of you are getting ready for Black Friday? I know I have a list going. Ana Luisa is going to be one of the recommendations that I make for you. It will be what I'm purchasing for some of my loved ones. So I hope they're not watching and that I'm not peeping the surprise. But if you take a look at these 3 pieces, look at how high quality they look with the sparkle. That's one of the things I have currently so many of their pieces. They're sustainable. They look really high class and expensive when they're not. And so with that, I have had them for a long time. I wear them constantly. You've probably seen the little green one that I wear constantly as well. And it holds up. It is not tarnished. It is not turned anything green. It still looks shiny. I know for me, like I've invested in a lot of like other pieces and they like tarnish and they look really dull. And so you can see that they look so nice. So anyway, while I'm waiting for that, I want to let you know that I already linked them down below. I have a coupon code there for you. So make sure you check that out if you're looking for something for Black Friday / all of your holiday gifting needs. Cool. I see you guys in the chat box and I am so excited to see LP. You're always here. My goodness. Love you. Now baby girl is nearly 4 months. That is so fun. Hi, Ronnie. Hi, Daisy. Yay. She's resting postpartum and now is perfect. She's finally here for a live. I don't do these very often. And so I want to get into your questions. Oh my gosh. And LP, yes, I remember this. The last time she listened to a live, she was 6 hours away from her water breaking. We talked about your water breaking and it was like, your water could break in any second. So those of you that are here, your water could break in any second. Let's have a round 2 live inspired birth. If you see, I'm actually in my office and I thought about, and you can see this is like my little YouTube corner. I thought about cleaning up for you, but I said no because I want you to see this is real life. So one of the questions I asked on a poll as your questions are coming in, if you have any that are live, I do have Instagram questions to answer, is what have I been up to? And if you've seen, I have not been posting quite as regularly as I have in the past. And that has been very much me prioritizing my needs. My business has exploded. The BUNDLEBIRTH nurses side, shout out BUNDLEBIRTH nurses, has also exploded over the last couple of years. And so that has taken a good amount of my energy. We are gearing up for our Black Friday over here. This is the biggest sale of the year. If you are trying to get a childbirth class, coping with labor, anything on our site, we also have some really cool products. The BUNDLEBIRTH position guide is going to be one that I'm going to suggest everybody have in their labor bag to help facilitate a vaginal birth. Yes, it does help. I teach a whole class on this to nurses. And so throw that in your cart. Everything will be 50% off starting like tomorrow at 9 p.m. PST on Thanksgiving. So that is our little fun Black Friday surprise. And with that, this is our little setup for our shipping area. We will be shipping all weekend, getting ready for you. Congratulations, Crystal. And yay, RSS squad. She watched my labor videos to help with her last 2 births. Gabrielle, she gave birth a couple of days later. So did Lindsay. Oh my gosh. Okay. So we want to hear follow-ups on your births. Cool. What happens after this live? All right, so I'm going to open Instagram and get to your questions. I saw some come in and I'm like so excited about them. I have missed you. I don't know if I can even say that because I know I've said like it's been really good for my soul to step away. We're in transition over here. We're doing some new hiring and all of that. And so, it's been really good for me. But at the same time, like, I actually really enjoy doing this. I love seeing your comments. I still pay attention, and I do have 3 twin videos still edited in the queue. They will be posted by the end of the year. That's my dream. So, with that, 28 and 1. Okay, you help my birth be so peaceful and empowering. Yes, that's the goal. Okay, Daisy, I see your first question. She says, can you talk about precipitous labors and birth? What they are, how often or why do they happen? Just had a precipitous VBAC a few weeks ago. That's like the ideal VBAC, honestly, because part of the concern with VBAC, by the way, if you don't know what VBAC is, that is vaginal birth after cesarean. And what that means is you had a previous cesarean for whatever reason, and now you're having a vaginal birth or attempting a vaginal birth. And there's a little bit more risk to that. There's some things you should know, which is why you should take my VBAC class, but wait to purchase it until Black Friday because it's going to be 50% off. And honestly, it's like the best case scenario that it goes fast. I don't know about precipitous fast. So let's talk precipitous birth really quickly. Precipitous labors and births are fast. Okay, so the technical definition of a precipitous labor or birth is from start of painful contractions to birth being less than or I think equal to 3 hours. No more than 3 hours, then you rule out. But still, that everything happens wham, bam, thank you, ma'am, super fast, and you kind of blow your baby out. So why do they happen? We don't know. There could be various reasons, baby. Like, first of all, I would say that your hormones have to be calm, but there could also be the other end of it could be a fear response that your body's like, I'm scared, boom, get the baby out because it feels threatened. Again, none of that is really within your control necessarily, other than for childbirth classes and, doing the calming stuff to like feel really confident going into your birth. But besides that, it just happens because it happens. And so I say your body's really efficient. Mind you, that does sort of carry some extra risk. There is benefit to the baby going through the birth canal and like navigating and getting smushed and squeezing the lungs and then like, transition to the outside world. They have a harder time transitioning when it's like wham, bam. So why do they happen? We don't know. How often? Occasionally, I don't have a number off the top of my head. I've seen a bunch. I've caught a bunch myself. And that can happen. Now, mind you, when I teach anything about labor or prepping for how long it may take, or, when to know when to go to the hospital, all of those videos that I have that you can watch on your own time, I do tend to give the classic sort of overarching information. So what applies to most people? There is always variation, flex and flow, right? That's why I say flex and flow so much, and that we're being flexible and going with the flow based on your sensations, etc. Can it go fast? Yes. Is it common enough that we need to talk about it all the time? Or even, I don't even think I have a YouTube video on it other than in Coffee and Questions. No, because it is still pretty rare. I would anticipate it taking longer than shorter. So I hope that sort of answered some of your questions. Hi, Brianne. Oh, 2 weeks ago. You're so welcome. Congratulations. All right. Gracie says, what are 3 tips? Oh, we're so specific. I love it. You give to a mama doing a home birth or a home birth VBAC. So HVBAC is a VBAC at home. So she's 28 weeks and 1 day. So first of all, I would say make sure that you have a really knowledgeable, equipped care team around you. And most home births you do, but you want to know the credentials of your midwife. You want to know like what's their transfer rate. I actually heard something recently. I wish I could tell you the source, but it was not me. So like I can't take credit for this, but that you want to ask your midwife what's their transfer rate. And it's actually a red flag for a home birth if it's super duper low. This goes for VBAC or not. Because you want them to be aware of signs that something is not perfect. And so if they're sort of priding, that's not a word. If they pride themselves on, not transferring to the hospital, that is a red flag. You want somebody who will transfer you if there's a concern. Does that make sense? And so like a reasonable number, that's somewhere around like 10 to 12% is what I've heard. Flex and flow on that, but have a discussion with your care team. What are the signs you're looking for? And when would you transfer me? So, and then that leads you into having like a really skilled provider to be able to recognize those signs. Okay. So that's number one. I love the 3. It's like very clear direction. I would say understand what a hospital transfer would look like. I would say to sort of jinx it, because I know you want to give birth at home. If you're attempting to give birth at home, you want to. But just because I come from a hospital background and because I've taken on so many home birth transfers as a nurse, that you need to be ready for a transfer. Know how to transfer home to hospital so that your expectations in the small chance that you do have to transfer to the hospital are not totally wiped, that you're not so defeated and so upset and just completely done with your birth experience if you were to have to transfer. And then I would say, and this might be a class coming, I am really looking for direction. We have a team retreat next year. I will give you a little bit insight into my life right now, kind of where we're going, because bundle birth stuff is starting to brew again. And by bundle birth, I mean for you as a birthing person or a patient, that I have had so much focus on nurses for the last couple of years that the shift is coming back to you. So get excited. I'll tell you more about that in a second. But I would say this goes for whether you're having a home birth, VBAC or not, or you're in the hospital. I don't really care where you're at. If you're giving birth / if you're a breathing human, I would say that the biggest piece of advice that I am personally learning for my own self and that I am trying to instill in literally everybody that I touch is that, this sounds really dumb to say out loud, but bear with me, that mindset matters. And this idea of while you're pregnant, you have the opportunity to become more conscious of all the things around you. And so this practice of being present and really connecting with your body in a totally new way, I think is one of the most beautiful gifts of pregnancy. And so with that, really being present in your body, really like knowing your sensations, listening to your intuition. And I think for a lot of us, we don't even know what our intuition is. And I would love to hear your comments about this. I will look at them in a second of like, do you feel like you can identify what your body needs? That could be as simple as like, what food does my body need? Do I need to rest? Do I need to exercise? Do I need fresh air, sunlight? Like really being in a place of being so connected to your intuition is what I'm going to call it. But like this inner knowing, your heart, your sensations in your body, and really trusting that no provider, regardless where you give birth, can tell you what you need in your body. No matter how, I will never, if I was at your birth, I will never tell you what you need in your body. I might make suggestions if you're feeling overwhelmed or whatnot, but past that, like, that's it. You know yourself best. And so the opportunity through pregnancy to really become present in your body is something that you will be seeing more of, whether it be on YouTube. I do have a class brewing in my head. And I'll just tell you right now that we are refilming and updating my childbirth class in January. It's on the calendar. It is paid for. It is booked. We are still looking for a venue here in LA to film it at, because I'm not going to do it in the office. But get excited, because I have learned and grown as a provider for providers, like an instructor for nurses and doctors and midwives worldwide over the last couple of years. And there are some really helpful tips that I have for you that I'm going to put in class format in a really beautiful way, updating the process. So thank you to all of you who have and are purchasing my childbirth class. A lot of the content will be the same, but there will be updates coming. And so my shift is that there will also be an update on the website coming in the new year, all of that. So those are my 3 tips. And they don't just apply to HVBACs, but they apply to all of you. So I hope you found that helpful. Whoa, hold on, let me scroll. I have to tell you, my L&D nurses used your labor position guides with an epidural at the hospital. I saw a sheet of paper with your logo and was like, wait, what is that? Bundle birth? Yes, I love it. And this is where, for those of you patients who are maybe concerned about hospital birth, there is so much amazing things happening through the BUNDLEBIRTH nurses community. Ask if you have BUNDLEBIRTH nurses on your unit. I'm going to trust and say that they are the best nurses. Not that I'm biased, because I totally am. But I have been training, I've trained thousands at this point, over 2,000 providers in physiologic birth techniques to help you get a vaginal birth, to help downregulate your nervous system so you're calm and not stressed out as much, and really be able to give the best care possible. So that's really exciting. And that focus, I know it has been on nurses, but truly that is for you. That ultimately the outcome means you get better care, you get more personalized care, and care that helps you accomplish your goals, whatever that is. Okay, my video on turning a breech baby worked. Yay! Okay, so I do have turning breech babies. If you have a breech baby, Dina, I think you actually wrote in on Instagram, so I'm definitely going to answer this question. Can you talk about breastfeeding after a breast reduction? Full supply, ? More painful than regular, etc. Okay, so usually my script, and I'll talk reduction and implants. So if you've had any kind of breast surgery, there is a risk that the connection, so like the ducts and then the like pathways to the nipple, have been damaged. Okay, so that's regardless. Now, for a breast augmentation or implants, really the incision matters most. Going under the breast is going to be most effective for not damaging the ducts in your, and like the breast tissue that helps with breastfeeding. If you go around the areola, that has a little bit more risk, but still most people that have breast implants can breastfeed. So I usually say any kind of breast surgery other than a reduction is, don't stress about it. That like flex and flow, expect that you can breastfeed. Now, with a breast reduction, what happens is that there's actual tissue from the breasts that have been removed from the breast, versus the structure being there and it just getting bigger, right? And so when you take out a piece of the breast, there is actually risk of it being more challenging to breastfeed. It is actually possible that some can't breastfeed, that they just can't get their supply high enough. And I would say not necessarily more painful. No, not physically painful, maybe emotionally painful with the disappointment. And so this is where I would say, you've heard it before if you've watched any of my videos, is hold your hands open, that we're going to flex and flow and see how it goes. I've had people that have had no problem. I've had other people that have not been able to breastfeed at all. They barely get anything, regardless how hard they work, and everything in between. And so I would say hold your hands open and then be prepared that expectation wise that you may need to supplement. You could also look into donor breast milk. There are like breast milk donation banks that you can give other people's breast milk to your baby. Have a lactation consultant on hand. All of you need this. Lactation, I actually just did a 3-day or a 2-day postpartum gig with a client here in LA, which I normally don't do, but I sort of couldn't help myself. I wanted to help. And it's just, breastfeeding is a beast, and it's different for everybody, and you need that support. And so have that person. And then also remember that it's not always about the milk, that there's the skin to skin, that there's the connection piece. You still get the oxytocin rush from the actual stimulation on the breast. And so be prepared to like fight for it if that's what you want, and just hold your expectations open. I hope that answered your question. All right. I love how you guys are supporting each other. All right. Okay, so Brittany Rogers says, currently pregnant with my third, due in January. I've had low platelets all 3 times, but normal when not pregnant. So this would be considered, I'm not diagnosing you, my guess would be this would be a diagnosis of thrombocytopenia in pregnancy, that in pregnancy you have low platelets. And platelets are our clotting factors. They are what helps us to clot our blood to not bleed too much, okay? My first 2 were on the bigger size, 9 pounds or more. Is there any connection between low platelets and big baby? Not at all that I'm aware of. No, I can't like make a pathophysiological connection. I think it's just probably a coincidence. Yeah, I'm curious to see if you chose to get an epidural or you were able to get an epidural, because that's one of the risks of low platelets. Hi, FKAT. She's been around for a long time. I love it. Okay, is pain around a C-section scar normal? I am so excited that you asked this question. You're probably all like, huh? Okay, I have so much to say. I'm 35 weeks planning on a VBAC, and this pain around my scar has me worried. The midwife says it's normal, but my anxiety it constantly needs calming. Okay, I love that you're asking this. Now, here's where there's a twofold answer here. If you are pregnant with a previous incision, it is something to pay attention to, because in the case of a uterine rupture, which is what we're all concerned about for a VBAC, that could be a sign that your scar is separating. Okay. So I have to say that out of love and care for you. Of course, it could also be totally normal. And if it's been consistent and you're being checked at your appointments and your midwife says everything's normal, then everything's likely normal, right? And so for those of you that do have a previous scar for a VBAC, that to be paying attention to the sensation on your scar. If it increases, if it all of a sudden becomes real burny, if it all of a sudden is like, oh my gosh, or you feel like you have to walk around holding your scar, like you're holding your scar together, that's not ideal. And that's something to notify your care team about. And so that's the one side. Now, pain around the C-section scar. C-section scars are any scar in our body. This is what gets me excited, because one of the updates for me is I have been doing a ton of my own learning, a ton of my own independent study, and going to classes and learning about some new things that's coming for our Cancun nurses retreat. In May, 400 nurses are coming to, hi, BUNDLEBIRTH nurses, are coming to Cancun and going to get trained in physiologic coping techniques and connect and come back ready to help you have the best births possible. So that's exciting. And along the way, I've been learning some new things, and partially with scar, any scar in the body has scar tissue. There's no possible way that that is the way the body heals. It comes together and it forms these pretty rigid connections in the fascial structures. And so what happens is our fascia in our body, this is like a mini class. I'm going to try not to get super ranty. Our fascia in our body is mostly water. It's how our body communicates with one another. It is one connected system that innervates or touches everywhere in our body. Every cell surrounds every muscle fiber, and it should be healthy and glidey. We should be moving freely and not stiff. Even now I'm like, oh, I got to do some stretching and move it out. This is where you get up in the morning and you're like, oh, hold on. Ooh, okay, hold on. Let me stretch it out, or oh, and then all of a sudden your range of motion increases, because motion is lotion, is what we say. And so when you move around, you create motion in the fascia, and then that loosens everything up, and all of a sudden you feel fluid, right? You go on a walk and I just feel so much more flexible. All of that is in your fascia. But when you have trauma to the tissues, physical or emotional, those tissues, when they heal, they're trying to protect you, but they can be nice and balled up and really tight and uncomfortable. Our fascia is the second most sensitive to pain in our body. First is skin, right? And thankfully, because if it's hot, I want to pull away. I want to be able to sense what's going on around me on my skin. But if you have pain anywhere, it's likely in the fascia. This is why I'm going to start recommending everybody go see a myofascial release specialist. I'm going to likely recommend a John Barnes technique, because there's a lot of not so helpful myofascial release techniques out there. And so with that what's happening in your scar is it's fascia. It's that tissue that's been damaged and has grown back, but maybe even needs some scar massage, right? And so as you stretch in your pregnancy, that scar tissue starts to pull. It's sensitive to pain sensation. And then you go, ow, that hurts, right? And so this is why it can be normal, and also why I anticipate a YouTube video coming on scar massage and how to massage your scars and help with any of that discomfort. So I could go much more on that. I hope that's calming to you and helps you understand what's likely going on. Oh yeah, water breaking for less than 4 hours, contractions to birth less than 2. Wow, yeah, that's definitely a precipitous birth. Amazing. Okay, let me go back. Sorry, it keeps scrolling on me. Ooh, speaking of, there is a theme I am seeing. Okay, I'm just gonna see what I see. So Crystal Price. She says, just hired a first-time doula. I'm her first client. You are going on her timeline of events. My first client as a doula, I still is like so near and dear to my heart. What suggestions for what to ask or be prepared for working with a first-time doula? So I do have a doula video. Please go watch that so you know what a doula does, what they should do, what they shouldn't do. There are doulas all on the spectrum of experience. And so you have the uber experienced doula, I would call myself that, and the not experienced doula, which is this new first time doula. And thank you for taking a chance on these doulas. It's very hard to get into the industry and to be trusted with your labor and birth. And so I want to remind all of you that a doula is there for physical and emotional support. Anybody can be a doula for you. Your partner's technically your doula. When I teach private childbirth classes, I'm like, hey, tag in, like this is your doula training, because emotional and physical support is capable of everyone. So I would say the biggest thing is that you establish a loving, trusting relationship with this person. And if you can do that and you can connect and trust that they're going to be there for you emotionally, that's all you need. Really. And I think a lot of times people put pressure on doulas for that, like education, for the know-how of navigating the hospital system, of making medical decisions, which by the way is totally not what they should be doing for you, of helping advocate. That's an art for sure. And so I would be prepared to know how to advocate for yourself. I would most definitely recommend you doing childbirth classes still. And then talk about and think about, what do you need? What does support look like for you? And then one of the biggest tips for working with any kind of support team, this goes for all of you, whether you have a doula or not, is have the rule. And I do have a YouTube video on this. It's on the older side, but it's like something about the like tip for partners. That's right after the tips for partners one, of like the rule I have. And that is that if your care team is doing something that works for you, you don't have to say anything. And if, though, they're doing something that you don't like, they're rubbing your back and you're like, get off, or more pressure, higher. No, that feels, right? A lot of times with labor, you sort of like lose your inhibition. So like you may just be like, like, no, stop, right? But if you have the connection that you look at each other, whoever's going to be in the room, and say, if I don't say anything, trust that it's working, that frees me up, that if I'm rubbing your back and you're not saying anything, I'm going to stay here because I'm assuming you like it. I don't have to worry about like, right? And so then I can just be free to be there. And I also trust that you're going to say something and I'm not going to be offended by it. So I would have that rule going in. And then I also would just remove the pressure from them, that they're not there to be your everything. They're there to help hold you together, to help see extra things, that like, it's as simple as like, your mouth is dry, here's some water. Okay. And so I would just be really connected and give them lots of grace and let them just be present and enjoy and know how to advocate for yourself. Okay, Valerie says, did you get my question on Instagram? If it was in a DM, let me look at my list. The list wasn't too long today. So if she says it was long, it's probably in my DMs. I love that you're here. Valerie. Okay, I did. Thank you for reminding me. All right, this is Valerie. Hey, Sarah, question for Coffee and Questions. As I messaged you before, I had a uterine torsion that resulted, I remember this story, that resulted in a placental abruption and loss of my baby this September. I am so, there are no words. This is awful. And I'm so sorry. My doctor had told me that he plans to deliver any of my future babies 4 to 6 weeks early via C-section due to my incision being on the back of my uterus to help me avoid a rupture. I know babies only need drops in the beginning and milk supply doesn't really come in until the baby's born. But when should I start working on my milk supply before those deliveries so that my baby/babies experience little to no nipple confusion? Okay. So first of all, I feel like I can't leave everyone hanging going, what's a uterine torsion? A uterine torsion is when the uterus twists. Anything can tort? Is that a word? I'm not really sure, but I know there's like a testicular torsion or an ovarian torsion, and they are kind of a medical emergency because you lose blood supply, and I'm sure that was awfully scary for you, and I feel so much for your loss. But I have to say that this is extremely rare for the rest of you hearing this story, and so gosh, you always wonder like, why me? And I don't have an answer for that. I'm just so sorry. So the question really is, what do we need to do prior to birth to help with milk supply, right? For breastfeeding? Nothing. Okay. So, and I can't even tell you, I love this question so deeply because I get this question constantly. There is so much stress around breastfeeding that like, I should be doing this. What about this? And I hear about this and da 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 da. You should be doing nothing. Now, that's a loose answer because you should know what your resources are for breastfeeding help. You should get a pump. Okay. And I'm gonna recommend Aeroflow. I have a link that I will put down there for Aeroflow. You can put in your insurance. They like figured out your insurance should cover a breast pump for you. Okay. But order that prior to delivery so you have it at home, just so you have that little safety net. Okay. It's better to have it. Have a Haka and learn some things about it because breastfeeding is like, I joke, it's like a second labor because it is. It can be very challenging. It can also be very easy, and it gets to a point where it becomes riding a bike. Very easy, but it's a learning curve. Okay. So all of that you can be doing, do that. But as far as milk supply goes, your body does not know to release the milk until your placenta is out of your body, which doesn't happen until your baby is disconnected, meaning out on your chest, and then you deliver the placenta. Okay. Now, you've probably heard of people collecting colostrum. Colostrum is the first milk. It is milk. I also hear that too of like, I don't have milk until later. That is not true. Colostrum is a form of milk. It is the most nutrient dense milk there is. They call it liquid gold for a reason. It's so good for your baby. Okay. You have milk. If you are more than 14 to 16 weeks pregnant, there is colostrum brewing in there and getting all nice and juicy for you. Okay. So with that, can you try to express, and I have a manual expression video on YouTube you can watch, sure. But what I hear constantly is, I don't have any milk because I'm not seeing anything come out. I only get like a drop. That's more than you would ever expect. Any milk you get prior to delivery is entirely extra credit. Hear me loud and clear. I couldn't mean this more from the depths of my soul than anything else. Okay. And so take a deep breath. Everybody who's stressed about breastfeeding, you do not even need to embark on that journey until your baby is out. Get through labor and birth, get through pregnancy, get ready, like have what you need. But past that, we're not stressing. Now, if you want to manually express and save some colostrum, I have a breastfeeding list on my Amazon list down below where I give you links to things that I currently have here in the office. And I'm going to suggest having some 1 milliliter syringes. There's a pack that I use with caps. They're perfect. Check out the breastfeeding list there. There's Haka colostrum collectors there. You're gonna not use those prior. Please do not use those prior. You will lose the milk. You will waste the milk, but you can freeze anything that you save. And this could be like literally drops. Save it, have it there, warm it up, give it to your baby in the syringe afterwards. And I actually have a TikTok reel, trying to get into TikTok. It's coming, I promise. All of this I'm working into. On how to do this. Okay. So go check out BUNDLEBIRTH on TikTok. You can see my little 3-minute tutorial on how to feed your baby with a syringe and how to like do all of this. So don't stress. Okay. It's going to be okay. And then nipple confusion. There's a lot of people that believe that nipple confusion is not a thing. It's really more, to me, what I see is a fake nipple, like a one from the store versus like a real nipple on your body. A fake nipple is much easier to suck out of, and babies are notoriously lazy. And so if they know that they can just like and get milk versus they have to like stimulate the letdown and really like draw and pull and work, they're going to go, no, I don't want that. I want the easy. And so this is where there's such a thing as a slow flow nipple that you start with if you're going to introduce a bottle early. Otherwise, that's where I see a lot of issues. If they get used to the fast flow. That's not like breast milk. And so it's not like the flow of breast milk. And so start with a slow flow nipple. Wait to introduce a bottle for the first at least 2 to 3 to 4 weeks. That will help. That was a lot of information. Okay. Yes. Daisy says, my pelvic floor PT helped me with adhesions. Adhesion caused me some pain. And I'm so glad I had a professional to help understand that. Exactly. That's the scar tissue I'm talking about. How can a doctor know if the scar is separating before labor or a repeat C-section? This has to do with a VBAC. So remember I talked about that scar separating, that's called a uterine rupture. You're probably going to know before your doctor knows, to be honest, because your doctor only knows based on the signs that you give prenatally. Now, if you're in the hospital, we can see some changes on the fetal monitor sometimes. Sometimes there's bleeding. There's a certain contraction pattern that we're looking for that's different than like labor contractions. But if you don't have an epidural, you're going to feel immense pain if the scar is separating. There's no world in which in my head I see it being that you would be like, oh, it ruptured. Like if your muscle tears in half, like you're gonna know. So you actually are the one that are gonna report that more than anything. Okay. Brittany Young says, can you have a TOLAC, trial of labor after cesarean, meaning attempting a vaginal birth after you've had a C-section? If your first C-section was a singleton, meaning one baby, are you a nurse? And are now pregnant with twins, the scar stretching seems even scarier. So the answer is yes, you can have a VBAC with twins. I've actually done one recently and it went fine, but you need a provider who's willing to do it. That's really the biggest thing with VBAC. You just need somebody who's going to care for you as a doctor. Okay. Rachel Arnold, I just did my glucose test and my numbers are 148. I know the cap is traditionally 140. Is that small difference in numbers usually a reason for concern? I will have to take the 3-hour test. So if your numbers are outside the range, I'm not going to say be concerned, but you definitely need to do the 3-hour because there's a chance you have gestational diabetes. If you don't know what that is, I have 2 videos on gestational diabetes. Just go to my channel, search gestational or diabetes, and the 2 will come up. I'm like in an orange shirt. I remember doing it like in front of the window right here. And so we're not going to be concerned about it, but I'm glad you're doing the 3-hour because yes, there is a chance that you have gestational diabetes. Okay, Crystal, I saw your question on Instagram. I love that you guys are here from there. Like, that's so sweet. Swelling in one leg and not the other. Should I be concerned? Again, I love that all of you are paying thoughts on laboring down. I see that too. Oh boy. Should I be concerned? No, you shouldn't be concerned, but you should call your provider today. And so that's where I'm not a provider. I'm not diagnosing ever, but swelling in one leg or pain in one, particularly calf, then the other, redness or heat in one side of your body or another. When you are pregnant, you are more prone to blood clots. And so we're not going to be concerned, but we're going to get evaluated for a potential blood clot, just to be sure. Okay. Now you could also, the circulatory changes in pregnancy, the weight of the baby, the pregnancy could be kind of blocking off your circulation. This is where range of motion, stretching, myofascial release techniques may be able to help kind of release because there's something clogged down there. If it's not a clot, we're praying it's not a clot. So I would say, yes, call your provider and say, hey, this is what's happening. And they're likely going to have you come to the hospital and just get evaluated. They'll do an ultrasound on your calf. They'll do some blood work and go from there. Let us know how it goes. Okay. Worked well. Oh. Okay. Ooh, this is good. Okay. Oh my. So many good questions. Sending you so much love. I love how elastic nipples. Ooh, Crystal Price, elastic nipples. What to do to help with pumping and breastfeeding? Okay, so by elastic nipples, I mean like there's some nipples that are kind of firm and they're like more like stuck in place versus an elastic nipple is going to be a lot softer and more like pullable. And so I would say if you're having trouble breastfeeding already, maybe have a lactation consultant look at it. But in general, if someone were to tell me this prenatally, I'd go like, okay, great. That the nipple is going to be able to be pulled because it needs to go like back to the soft palate in the baby's mouth. If they're not like on the nipple, you actually want like breast in the mouth. So I would use the like C cupping technique where you're sandwiching the breast. Like notice my boob is now like a sandwich. We want to eat the sandwich like this, not up and down like this. That makes no sense. Like trying to get your mouth around it. So we want to sandwich the breast and have them take areola in the mouth, and then nipple will get sucked in. But if they can grab onto the areola, which is the dark part, you're going to get better milk release. So I wouldn't be worried about it unless it's already causing issues, and then just have a lactation consultant evaluate and they can give you tips because that's going to be really individualized. I'm a labor and delivery nurse with home births growing. How do I become a doula? I don't know if I should have read this one out loud because I don't know that I want to answer this question live, but I will because now I'm caught. Okay, Irene, you're a labor and delivery nurse with home births growing. How do I become a doula? So let me just be clear. This is entirely the decision that I have made professionally based on multiple attorney consults, a lot of money spent, and wanting to be in this industry for a long time. That as a nurse, when you carry a nursing license, you are obligated to practice as a nurse. You can't it's not like if I'm not a nurse now because I'm not working in the hospital. Like I am a nurse. I've maintained my licensure. And so I'm a nurse. When I have clients, I offer nursing services. And you will never see anywhere public that I am a doula. I use that terminology because it's what people connect with. But publicly, I'm a labor nurse and birth coach because my nursing license will always trump doula. In terms of certification, I'm actually licensed through a board. I have accountability to my job, profession. With that, in a home birth scenario, I have chosen not to participate in home births, not because I don't believe in them, not because I don't think they can be done safely, but because as a nurse, it is uber complicated for me legally that if something were to go wrong, I am obligated to respond because I'm a nurse, but I'm also obligated not to respond because it's technically outside the scope of my practice and I'm not functioning under a provider. So I'm stuck between a rock and a hard place of what do I do? And I don't want to be placed in that situation where I'm liable to respond, but I'm also liable not to respond. What do I do? And either way, it becomes a liability to me. So that's something to consider and something I went back and forth with because I would love that. But you're never going to be a doula technically because you carry a nursing license. So this is where I do dream of training nurses to be birth coaches and do it legally and have the contracts for you and make it really simple because I know there's so many nurses that want to be this. Now, here is where that was sort of a detour because how do I become a doula? You're a doula. Everybody's a doula immediately right now because you decided to be one. And so this is where those of you that are choosing doulas, you want to ask about their training, their certification, their ongoing training. How do they stay up to date? How do they know what's going on in the birth world? How do they know what's evidence-based? And what recommendations are they making for you, right? So that's sort of something to consider. Along the lines of becoming a doula, there are doula trainings out there. I took a DONA training. DONA and CAPA are probably the most prestigious of doula certifications, but I could choose to certify doulas tomorrow and I would, right? There's no licensing board. So you can decide you're a doula. I would have some really hefty contracts in place. And then think about where are the gaps in your knowledge and education. This channel is going to be really helpful for you. Honestly, my childbirth classes and coping with labor class would be really helpful for you in your training. And then also the nursing classes we have available on bundlebirthnurses.com. So I hope that answered your question enough. Okay. I want to get to the bottom so I'm not missing much. And actually it always goes to the bottom. Okay. So many good questions. I'm loving these sessions. Okay. Is a VBAC after an emergency vertical scar something that ever happens? Brittany, FKAT also has the same question. So a vertical incision is pretty uncommon. Okay. And a vertical incision, let's be clear, is different than what you see on your abdomen. If you have I'm going to show you my belly. If you have a C-section, usually it's down here and it's transverse or long on the belly. Okay. Now, just because you had a transverse and like scar doesn't mean that the incision on the uterus inside the layers isn't vertical. So this is definitely something, if you're thinking about a VBAC, that you want to ask about. A vertical incision on the uterus is an absolute contraindication to a VBAC. So if you've had a vertical incision, a VBAC is not an option for you. I've never heard of anyone doing it, and it is more risky than it would be to attempt a VBAC. So I'm sorry for that loss if that's something that you want, but no, it is an absolute contraindication medically. So many VBAC questions. This is really interesting. Okay. Oh, I have, ooh, this might be how we end because it's 45 minutes in. Okay. Because this is applicable to absolutely everybody. And this is like a nugget of wisdom that those of you that have stayed are going to get. And those of you that have stuck around watching this later are going to get. Okay. I teach an 8-hour class that could be like a 40-hour class on this for providers, nurses. If you're a nurse, if you're a midwife, if you're a doula, I have a doula class, by the way, coming in February. There's a doula version of this class. Please come to this class. This is your foundation of your practice. All right. So I'm going to give you a little sneak peek because this is like my expertise. Okay. She says, I have had 2 C-sections, and during my second, I had a toe lac, and I was stuck at 7 centimeters for 6 hours. What would be the cause of me stopping dilating? I was changing positions and having consistent contractions. Okay, so how many of you this happened, right? And so you can comment down below, comment in the chat box if you're here live, because this is extremely common, okay, that your cervix stops dilating. There are so many things that have to align, and I share this in my medical interventions and cesarean class in detail. Excuse me. And so with the cervix being stuck, some reasons for that are the position of the baby. Baby needs to be tucked. It needs to be entering the pelvis straight, not off to the side. That can make it more challenging. It needs to be facing ideally the right direction. That's a loose one. You can watch all my sunny side up or occiput posterior back labor videos for that. And you'll learn even more about that there. So the baby needs to be entering the pelvis correctly. The pelvis, it is movable, right? And actually, here, where's my pelvis? Right here. So the pelvis is fluid, right? It needs to be able to move to accommodate the baby. Let the baby in, lock and load, let the baby out, right? And move the sacrum out of the way. Especially if you were changing positions. That's one of the reasons why we change positions so frequently. So those of you that weren't changing positions, position changes is one of the most simple, safe interventions to help with labor progressing, meaning your cervix to dilate and the baby come down. So it could be a pelvis issue. It could be a position issue with the baby's head. It could be the heart rate of the baby was dropping, which is not the case in this case, right? You got stuck, so that's different. There could be a power issue, meaning like the contractions just aren't strong enough. You were having consistent contractions, but how actually strong were the contractions? The only way to know that is by very sensitive palpation from your nurse or doctor. And even then, like their fingers are subjective. But if you have an IUPC, I teach about this in my medical interventions class. It's a little tool that goes inside the uterus, tells us exactly how strong the contractions are. So it could be your contractions aren't strong enough. There could be psyche involvement. And this I teach in the class that is like beyond, right? That like a lot of times, I teach this in my VBAC class as well, that the moment you got stuck with the first is likely there's like this hump you have to get over, right? If you're so fearful, this is why childbirth classes are so important, that if you're so fearful that that tenses you up and you have resistance, right? This resistance for a process that needs to be soft and smooth and open, and relaxed, right? That's counterintuitive, right? There could be ligament tension, there could be fascia, there probably is fascia, there could be pelvic floor restriction. Pelvic floor therapy can help with that. And sometimes it truly is, and if you've been around, you know that I don't like talking about big baby, but there's the size of the baby thing, right? That if your baby's head is the size of my head, I am never going to fit through this type of pelvis. I don't care how hard I try. Right. And so if there's a truly a puzzle piece issue, sometimes they just can't come down. You need pressure on the cervix. I'm going to wait for that truck. You can probably hear that. I'm in the heart of LA right now. You need pressure on the cervix to help release prostaglandin, which softens your cervix to make it go away, which tells your brain to release oxytocin, love hormone, also contraction hormone, to help bring the baby down. And so maybe there just wasn't enough pressure on the cervix. There's a lot of reasons for that. Short umbilical cord is something that people don't talk about a lot either, of if the umbilical cord is this long, when the baby tries to come down, it's like being held up by a really short cord, right? And so there's so many different components. Those of you that have had a vaginal birth, be so grateful that they all aligned, and how often they align, because we're meant to align, right? But sometimes it just doesn't, right? And so this is where I don't know necessarily why you stopped dilating, but one of those components for sure was the answer. I just don't know which one. Okay. I love your comments. I'm going to have to go back and read them. I love when you talk to each other. Would I recommend getting a membrane sweep at 39 weeks? Absolutely, without a shadow of a doubt. I think it's the most helpful thing if you're ready to have your baby and you're down with it. 100%. I love me a membrane sweep. I recommend it to all my clients. Oh yeah, and if you're 5 centimeters, stir it up in there. Okay. I think that is long enough. But I know I've said this before, and I will say this again. Thank you all for being here. Thank you for sticking with me. Thank you for those of you who've already given birth and are still around hanging out. I promise you, I'm actually in the process of looking for somebody to hire to help me with social media. My team has expanded to 9. And we are growing and excited, and my energy is shifting to pregnancy, labor, birth, and postpartum in the coming season of 2023. And so I want to make that verbal commitment to you. New childbirth classes are coming, new other supplemental classes are coming, more YouTube videos are coming. Although now I'm like, gosh, what else can I talk about? And then I think of 100 other things I could talk about. And so TikTok will be coming. So stay tuned there, because I think the shorter form is really nice also as a supplement to your learning. Remember that Black Friday sale is coming tomorrow. So this is through Cyber Monday. All of my childbirth classes will be 50% off all of the tools that we sell. So click around the bundlebirth.com website, check that out. If you don't follow me on Instagram, TikTok, if you don't subscribe, please subscribe down below. And then I also want to remind you, check out Ana Luisa. I've already linked them in the description box below, and get yourself a little beautiful surprise. Get your moms, get your sisters, get your partners. I'm serious. Even the earrings, there's a pair of hoops, literally the only earrings I wear are theirs. They're so perfect. Also for babies, a baby, a hoop, maybe not, but they're small enough that you're not worried about them getting your earlobes ripped off along the way. They also, I always mention this, they have a mama necklace that I have gifted for many a baby shower. So check them out. They are awesome. I wish you lived closer too, so you could help with my page. If you have other suggestions for what you are looking for, what you need support in, please comment in either the chat box here or in the comments down below. We are watching those, and we are in we literally have a retreat next week with my team in Palm Springs, and we are going to be just soaking in clarity. That is what we're asking for, of what does the world need? What do you need? And how can we just love on and care for and educate and support you better throughout your parenting journeys? And so I'm still here. We're thinking about you all the time. And if you want to stay connected, Instagram is probably the best place to see me more regularly. And thank you for being here. And we will do this again sometime very soon. So thank you for being here. Don't forget to flex and flow, and I will see you very soon. Cheers.